All right, thank you, Alan. That was really interesting, and I felt like the number of organizations providing care and financing the care was like overwhelming for someone who don't know the system, at least not yet. Next, we move from Germany to from France to Germany, which is indeed an interesting country to study because the number of elderly people relative to population exceeds that of Finland. Yeah. So our next speaker is a policy advisor for social policy at Friedrich Ebert Stiftung, Friedrich Ebert Foundation, which is the largest and oldest of the German party-associated foundations and has projects and offices in over 100 countries. So it's my great pleasure to welcome Mr. Severin Schmidt on the stage.
Thank you very much. First of all, I would say I'm not used to speak in English, so if I say something wrong, it's totally because of the language skills and not because it's just wrong. And maybe the interpreter is responsible for the right numbers. Thank you very much for the presentations. I think problems are quite comparable, especially to France. I saw some problems, some issues which are quite comparable to Germany, actually. And I think, as you said, it's a worldwide problem concerning almost all the industrialized countries. I would say not only the industrialized, but also countries like Brazil and South Africa, for example. BRIC countries are quite affected by this problem or challenge of elderly care. My presentation will be structured in the status quo, so we'll get some numbers, but very shortly. You will get the characteristics of the elderly system in Germany, and you will get some political solutions, reforms proposed by our foundation. Wow, status quo. These are actually the numbers of Germany, quite comparable to France. I think our age structure of our population is quite comparable to France. We are much older than Ireland. And what's interesting about these numbers is that the number of people in need of care are going to double until 2050, which is not too long away. I mean, it's going to be 1 million more to 2030 and then to double 2050. It's 35 years. It's in terms of political reforms, it's not a long time, actually. And as you see, what's interesting in the numbers as well is that care is actually a problem of people older than 80 years old. It's not surprising, but if we consider that the years with the highest birth rates in Germany were between 54 and 64, the so-called baby boomers, these people is going to be older and older during the coming decades. What is interesting is that 2/3 of the people in need is being cared by relatives. It's very characteristic of the German system that actually the families are doing the care work in Germany. 2/3 of them. And also, there's a trade union called Verdi, which is the trade union of the services. It's a service union. They suspect that 115,000 migrants, especially from Poland, from Bulgaria, are actually carrying 24 hours in German households. I would say it's much more. I think it's between 150 and 200,000. But of course, some of these labor relations are not legal, so it's kind of hard to get numbers actually, which is kind of logical. But of course, if we didn't have these kind of migrant workers in the German healthcare system, the system would break down in a couple of months. So Europe is talking a lot about adopting the German model. I wouldn't be that sure, not only in this area, but also in other areas. We're getting more and more single households. In 2030, we expect 23% of single households, which means if you have a care system which is dependent on the family care, it's going to be quite hard. If you have only single households, who's going to care for these people? I mean, it's not going to happen. And what we need is more professionalized care system. Of course, as in every aging society, much more people suffering of dementia, much more. It's today 1.4 million. It's going to be 2.2 million in 2030, which is also not a long time, 16 years, not a long time for these reforms. The source is actually the Ministry of Health, so it's a quite official number. And we are missing qualified people working in hospitals and also in the whole caring sector. I think it's a problem Finland has also. We expect 70,000 missing qualified employees. Just for one region in Germany, North Rhine-Westphalia, which is like the biggest region in Germany, 18 million inhabitants, PricewaterhouseCoopers expect that they're missing 40,000 employees until 2030. So this is like the framework of our care policy. This is some tabloid. Some titles from tabloid newspapers and from other newspapers. For example, Bild, which is like the biggest and worst newspaper in Germany, but still quite influential. They're saying, "Darf ich Mutti in Thailand pflegen lassen?" So am I allowed to send my mother to Thailand to be cared over there? It's a big discussion going on in Germany if we send like older people to other countries to be cared, but it's of course not a real option, to be honest. Pflege, Selbstanpflegefall, which means like we need some care for the care sector. Pflegenotstand, which is like a new German word, says the care, emergency of care, which means that the care sector is also in a catastrophic situation, actually. I would like to give you some characteristics of the German elderly care system. It was actually adopted in 1994 and introduced in 1995, which is like, we have 5 different columns of social security. Most of them were introduced in the 19th century by Chancellor Bismarck. So principles of our social security system is very old. But the care system, the elderly care system, was adopted in 1994. And this explains a lot, because in 1994, there was a lot of discussion going on in Germany about the costs of labor. During that time, Time magazine in Great Britain said Germany is Europe's sick man. It was considered as a very weak economy going down 20 years ago. Times change from time to time. And it was introduced in 1994, and the plan was to introduce the social security scheme, but the aim was to limit costs. So the whole system is constructed to limit the costs for elderly care. It's totally different from the healthcare system. It was like, it was pay-as-you-go finance, like all the social security columns in Germany. And it was usually half of the costs were paid by the employees and the other by the employers. This has always been the principle in the German social security system. But this time, politicians said we have to abolish one public holiday, Lutheran public holiday, 12th of October. I don't know how it's called in English, Buß- und Betag. It was abolished in the whole country, despite the one region which are really like Lutheran fundamentalists. No, joking. Well, actually, this law was adopted by Social Democrats, Christian Democrats and Liberals. During that time, Helmut Kohl was Chancellor of Germany, governing with the Liberals. So it has a lot of influence of neoliberalism and some influence of the social tradition as well. They introduced 3 different care levels, which is quite comparable to France, even in the amount of money you get. there are 3 different levels from 1 to 3. 3 is like the worst situation for the person in need of care. You get if you are in need of care, somebody from a doctor from the insurance comes to your home and sees if you need how many time you need actually care every day, from 90 minutes to 3 hours or 24 hours, and then you get the opportunity to get like direct help, or you can get the money, which is, I think, is actually quite unique. I'm not quite sure if it's comparable to other countries. The family can decide if they get direct help by professionals, or if they get a certain amount of money, family money, Pflegegeld in Germany. They can actually do with the money what they want. So the idea was from the very beginning of the insurance to let the families organize the care, and that's, of course, the reason why so many legal and illegal immigrants are working in German elderly households, because the family can decide what to do with the money. And it was actually the purpose of the law. So, of course, let me say one thing: the status of the immigration workers are legal at the moment, because Bulgaria and Poland is part of the European Union. But of course, they're working most of the time 24 hours a day. They're actually living in the houses, in the private households, and that's, of course, against the German labor law. So it's quite abusive, actually. There's a partial coverage insurance. That's what I meant. In comparison to the healthcare system is different. If you are ill and the cost of your illness is, let's say, 500,000 euros, it's going to be paid by the insurance. It's different in the care sector. The care sector covers just a part of the real need. So there's a lot of private money invested, but also money by the social assistance at the local level. If a person doesn't have the money, social assistance is going to pay. If the private wealth is enough, of course, private money is used for the care. There are some elements of competition, and I think that's quite interesting for the Nordic countries. That there's competition between the care givers. There are a lot of small companies, but also bigger companies, competing for older persons to be cared, actually. And we had a discussion a couple of months ago with our Swedish friends, and we said we want to, actually in Germany, at least our foundation, we want to reduce this kind of competition, because it has some really bad consequences. And some friends from the Nordic states said, we would like to introduce more competition in our system, because we would have more providers, which is true, but at a very high price. I mean, it is family-based, as I said, instead of service-based, like in the Nordic states. We don't have like established social services market. It's actually family. And here again, as in the healthcare system, there's a separation between the statutory system and the private system. If an employee has more than, I think it's 55,000 euros per year in Germany, he can get out of the statutory system into a private system. There's no big difference in the payments of the private insurance, but the difference is that our statistics show that people with a higher income don't get, they're not so often in a situation of needing care as people in the statutory system. So the private insurance in Germany has about 30 billion euros for care, but on the they don't spend the money, actually. And of course, another point is the underrated work of care. I think that might be quite different in the Nordic countries. That actually all the jobs related to care are not really well paid in Germany. They are not. They didn't used to be really respected. Also, I mean, we have if we take the system of Esping-Andersen, we have an old Catholic system of social security, and care was considered as like something women do, which is not as important as industrial work or work with technical issues. So you can see that, for example, care, children's care, but also elderly care, is in the structure of payment and the respect of the population not as good as, for example, work in the industrial sector. I think it's a big problem, especially if you consider that we actually need more people working in the care sector. Well, current political reforms, just a couple of minutes. There's adopted actually this week and the last week and a new system. And the biggest change is we used to have 3 care levels, but now I introduced 5 care levels. And it is because the system was very oriented on like the physical problems of a person. But now, if more and more people have dementia, the system has to go to and to see as well as the cognitive problems. So what we are trying to do now is like looking, is the person in what physical condition is the person, but also what cognitive problems are actually there. This law is adopted this year and the next year. And one big issue in the discussion right now is also the compatibility of elderly care and work, which is also logical if you have a family-based system. One has to see that there's a combination. Okay, 5 minutes. Okay. Time is running. So we have different laws at the moment. For example, there's a law allowing the person to reduce the working time at 15 hours. There will be compensation of loss of income by a credit, and the person needs the consent of the employer, which is not really a revolutionary idea. Especially if we consider that a lot of caring people is not working anymore because they're also more older than 60 years. There's some discussion going on about recruitment of qualified employees. A big discussion about recruitment in foreign countries. We would like to, we point out also that if we recruit somebody from foreign countries, of course, these countries will get problems in their own healthcare systems as well. We can see it in Poland, for example. And there's going on a debate on the extension of social services, which is not a really big market in Germany. We need services, social services, as alternatives for the family-based system. And also, and this might be the most important discussion, is which role is going to have the local level, because the biggest actors in the system are actually the insurances and not the local level. But the local level needs to be more important during the next years, because they actually know what they need in their towns. So that's something we could adopt from France, actually. Well, these are the political discussions at the moment in the country. And I think that's all. Thank you very much.